Good evening and welcome. This is COVID-19 update on Mitv. I am Tomi Singh Ojo.
And I am Omolola Ololade. You're welcome on the program.
We'll start out this evening with the news from the local scene and then to that of the foreign scene.
Yes, starting with local news, the 11 electricity distribution companies DISCOs have said they will align with the bill before the House of Representatives proposing free electricity supply to all Nigerians for 2 months to mitigate the harsh effect of the novel coronavirus COVID-19 on the power consumers. The DISCOs operating under the aegis of Association of Nigerian Electricity Distributors ANED promised to abide by all measures taken by the federal government and the National Assembly to the hardship occasioned by the dreaded disease on the country. According to a statement issued last night by Barrister Sunday Oduton, the Executive Director, Research and Advocacy of ANED and spokesperson for DISCOs, the companies, however, reiterated their commitment to improving service delivery to the power consumers. The Lagos State government said on Tuesday it has recorded 2 new coronavirus COVID-19 deaths as the total confirmed cases in the state hit 379. The State Commissioner for Health, Professor Akin Abayomi, through his Twitter handle, said the disease included a 45-year-old man and a 36-year-old woman. One of the deceased was a 45-year-old Nigerian male who returned from India in January 2020. The second death involved a 36-year-old Nigerian female with severe underlying health condition. She had no history of travel or contact with any COVID-19 patient with any COVID-19 confirmed case. Abayomi said, according to him, the number of COVID-19 related deaths in Lagos now stands at 16. At least 98 patients had recovered and have been discharged. 2 patients have been evacuated, while 3 have been transferred to Ogun. An Ilorin magistrate court in Kwara State on Tuesday sentenced 8 violators to 1 week community service for allegedly violating the state government stay-at-home lockdown order in a bid to curb the spread of COVID-19 virus in the state. The state government had consistently expressed serious displeasure over flagrant disobedience to stay-at-home directive by the resident and therefore set up a mobile court to sanction the erring resident to serve as deterrent. The first group, according to the judgment delivered by Chief Magistrate Bio Saliu, were to sweep from Tipa Garage to Central Bank of Nigeria headquarters, Ilorin, about 5 kilometers away. Other group are to sweep the street beginning from Moraba to Government Secondary School roundabout, Ilorin, shorter distance. And that's it on the local scene.
All right, coming to the foreign scene, a World Health Organization driver has been killed in a conflict-riven region of Myanmar while out collecting COVID-19 monitoring samples. Pierre Son Wing was driven a well-marked United Nations vehicle when it was hit by gunfire in Rakhine State. The United Nations says dozens of citizens have been killed as fighting between the military and armed ethnic Arakan army group escalated in recent weeks. The 2 sides have blamed each other for the WHO driver's death on Monday. Both the military in Myanmar, also called Burma, and the Arakan army denied being involved. Myanmar's Major General Tun Tungi, a military spokesperson, said its forces had no reason to attack the UN vehicle. The United Nations office in Myanmar said it was saddened by the 28-year-old driver's death near a military checkpoint in Mindia Township. And here in Africa, a Tanzania member of parliament has tested positive for coronavirus, triggering calls for a suspension of ongoing House sessions. Without naming the politician, the Deputy Speaker, Tulia Ackson, said the member of parliament traveled to the commercial city, Dar es Salaam, the country's epicenter of infections. She believes that is where the member of parliament contracted the virus. Parliament session started 3 weeks ago, albeit with few members of parliament in the chamber, shorter hours of discussions and some debates held over video conferencing facilities. The Speaker of the Parliament, Job Undugai, has defended reconvening amidst the epidemic, arguing that the country's important operations must continue. And lastly, from the foreign scene, Italy would announce its plan to gradually exit its lockdown by the end of this week. The Prime Minister Giuseppe Conte said In a Facebook post, Conte said the country could not give up its policy of maximum caution and said Italy would reopen in line with serious scientific ploy. A reasonable expectation is that they would apply it from May the 4th. Italy has reported 24,114 deaths, the highest recorded toll in Europe. And data released on Monday showed the number of people officially confirmed as infected with coronavirus had dropped for the first time since the outbreak began. Italian authorities said the symbolic drop of 20 cases was a positive development. And that's it on the COVID-19 news update. Over now to the COVID-19 global case update. We have a total now of 2,529,094 global cases of coronavirus. And the deaths now stand at 174,573. 667,609 people have recovered from the deadly disease. The number of people who have serious and critical condition worldwide is now 57,601, and that's just 3% of the total number of active cases, which stands at 1,686,912. 1,629,311 people, 11,000 people are in mild condition, and that takes about 97% of the global active cases. Going now to the confirmed cases per country, the United States has risen once again to about 803,018 cases. Total number of deaths in the U.S. today stands at 1,044 deaths, and total number of deaths in the United States totally now stands at 43,588. 558, pardon me. Spain now has 430 deaths today. Total number of deaths in Spain, 21,282, while the total number of cases in Spain is now 204,178. Italy, 183,957 cases, while they have 24,648 deaths totally, and the number of deaths today, 534. In France, no deaths today was recorded. 155,383 is the number of cases they have, and the number of deaths totally 20,265. Germany, 147,958, while they've recorded 472 deaths today, bringing the total number of deaths in Germany to 4,934. The UK has 129,044 confirmed cases, while they've recorded 828 deaths today, bringing the total number of deaths to 17,337. And Turkey has 95,591 cases, 2,259 deaths, with 119 of that happening today. Iran, 84,802. That's the number of confirmed cases. The number of deaths today, 88. Total number of deaths, 5,297. And lastly, the last 10, China, 82,758 cases, no deaths today, and total number of deaths is now 4,632. Looking at some of the lower numbers, Yemen is still one of the lowest in the world, and Yemen just has 1 case, no death. Anguilla, another low one, 3 cases, no death. Bhutan, 6 cases, no death. Turks and Caicos, 11 cases, 1 death. Fiji, 18 cases, no death. Chad, 33 cases, no death. Nepal, 43 cases, no death. Sierra Leone, 50 cases, no death. Guyana, 66 cases, 7 deaths. Equatorial Guinea, 79 cases, no death. Ethiopia, 114 cases, 3 deaths. Gabon, 120 cases, 1 death. Paraguay, 208 cases and 8 deaths. Kenya, 296 cases, 14 deaths. Georgia, 408 cases, 4 deaths. The Democratic Republic of Congo, 350 cases, 25 deaths. Malta, 443 cases with 3 deaths. Burkina Faso, 581 cases, 38 deaths. Niger Republic, 655 cases, 20 deaths. Costa Rica, 662 cases with 6 deaths. And finally, Nigeria, 665 cases with 22 deaths.
Thank you, Tomisin, for a global update of the cases all over the world. And now to Nigeria, we have a total of 665 total confirmed cases with 188 discharged. And of course, we have 22 deaths here in Nigeria. A breakdown of the cases state by state. We'll start with Lagos, which is of course the epicenter of the disease here in Nigeria. Lagos has a total of 376 confirmed cases with 266 active cases, 97 number of discharge and 13 number of deaths. Move to Abuja and FCT. We have 89 confirmed cases, 51 number of active cases, 35 discharge and of course 3 deaths. Moving to Kano. In Kano we have 59 number of confirmed cases. We have 58 active cases, no discharge and 1 death. In Osun State, we have 20 number of confirmed cases, 2 active cases, 18 discharge and no death. In Oyo State, we have 16 number of confirmed cases, 11 active cases, 5 discharge and no death. In South of Nigeria, in Edo State, we have 15 number of confirmed cases. We have 7 number of active cases, 7 number of discharge and 1 death. In Ogun State, we have 12 number of confirmed cases, 7 active cases, 5 discharge and 0 death. In Katsina State, we have 12 confirmed cases, 11 active cases, no discharge and 1 death. In Kwara State, we have 9 confirmed cases, 7 active cases, 2 discharge and no death. In Akwa Ibom, we have 9 confirmed cases, 5 active cases, 3 discharges and 1 death. In Kaduna State, we have 9 confirmed cases, 5 active cases, 4 discharges and no death. In Bauchi State, we have 7 confirmed cases, 2 active cases, 5 discharges and 0 death. In Gombe State, we have 5 confirmed cases, 5 active cases, no discharge and no death. In Delta State, we have 4 confirmed cases, 3 active cases, no discharge and 1 death. And back to Southwest, in Ekiti State, we have 4 confirmed cases, 2 active cases, 2 discharges and no death. In Borno State, we have 3 confirmed cases, 2 active cases, no discharge and 1 death. In Ondo State, we have 3 confirmed cases, 2 active cases, 1 discharge and 0 death. In Rivers State, we have 2 confirmed cases, 0 active case, 2 discharge and 0 death. In Niger and Jigawa State, we have 2 confirmed cases, 2 active cases, 0 discharge and 0 death. In Benue State, Anambra and Sokoto State, which is of course the lowest number of cases in Nigeria, we have 1 active case, 1 confirmed case, no discharge and no death. And that brings the total number of cases in Nigeria to 665 confirmed cases, 455 active cases, 188 discharges and 22 deaths. That's it for Nigeria. Back to you, Tomisi.
Right, that's the update totally from the globe and Africa and of course in Nigeria. We'll take this quick break. When we come back, we're looking at Lagos, we're looking at testing and we're looking at transmission. Especially now, the community transmission has become a thing to worry about. We'll be back after now. COVID-19, popularly known as coronavirus, is now a global pandemic as the World Health Organization has officially declared it and is fast spreading. So, as individuals, we must take the following precautions. Wash your hands, often with soap and water,
for at least 20 seconds, especially after blowing your nose, coughing or sneezing, going to the bathroom, and before eating or preparing food. Avoid touching your eyes, your nose, and mouth with unwashed hands. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. You can help stop COVID-19 if you observe anyone with cough, cold, fever, or all of the above signs, or a person who has recently traveled from an area with ongoing spread of COVID-19. Please call the NCDC toll-free number for guardians. The number 080 097 0000, 080 097 0001, 080 097 0002, 080 097 0003, 080 097 0004, 080 097 0005, or 080 097 0006, 080 097 0007, 080 097 0008, 080 097 0010. Do not engage in self-medication. Stay home if you are ill, and collectively, let's prevent and stop coronavirus.
Olele, olele, moliba makasi.
Olele, olele, moliba makasi. Olele, olele, moliba makasi.
Welcome back to the COVID-19 update on MITV. Joining us this evening to talk about COVID-19 in Lagos, especially looking at transmission and testing, is the Permanent Secretary of the Ministry of Health, Dr. Segun Oboye. Good evening, sir.
Good evening.
Good to have you with us this evening.
Pleasure to be here.
We know that you're working seriously to ensure that Lagosians remain safe. I must ask, first of all, that how is that going?
Well, we're doing our best. Right now, we're trying to deal with the community transmission that's going on. So we're doing what we call an intensified case search now. We have teams that are going around all the 20 local governments, going from door to door and going from hospital to hospital, looking for people with signs and symptoms of COVID. And then when we...
Hello, sir. Yes, we can hear you loud and clear.
Yes.
All
So
right,
we go from house to house, and then when we ask questions about certain symptoms, fever, cough, and all that. And if we find people with a history of those things, then we take a sample for testing. And if we find anyone who's positive, then we take them into isolation. Okay. We're doing that also with, apart from door to door, we're doing it also in health facilities around the 20 local governments as well.
But there is the accusation here, Omolola is also here with me, mind you, but there is the accusation as well that people have been calling, because we've gotten certain calls and people say they've tried to reach the number and they cannot get through.
Yeah.
Well, initially we had those complaints and we totally revamped the call center because of that. We've strengthened it, we've improved the technology in the center, and I believe that complaint has actually reduced a lot now. And we've also introduced more doctors in at the back end of the call centers as well, who can do some triaging from the calls that they get and ask further questions if necessary. So we've done a lot of work to improve that. I really don't think that the issue with the calling in has persisted.
Okay. All right.
Okay, so I'm talking about testing. Yesterday, Lagos did not record any case, but recorded 70 cases the previous day. Should we say things are getting better, or can we attribute it to the fact that test results are not coming out?
What I would say is no, we cannot say things are getting better based on that. We probably didn't run as many tests yesterday as we did the day before, and so we have just a slight backlog of testing going on. So I mean, when we get the results of that, we will have a clear picture of what is going on.
But how many tests? You said that means we did lower tests. How many tests per day is Lagos State? Because the NCDC said Nigeria is doing about 7,000
a week
daily, and since Lagos is the epicenter, should we assume that about 35 to 40% of that number is being conducted in Lagos?
We currently basically have the capacity to do at least 500 tests per center per day, so we can do 1,500. Because we're now doing 24-hour testing. We have shifts working in the labs now.
Okay. Which brings us to the issue of the testing centers. You just mentioned 3 centers, so you have the capacity to do 500 per center. That's about 1,005.
Yes.
Just about 2 days ago, the Lagos State government did announce that you now have 26 coronavirus test centers across the state. When are the centers going to begin operations?
Okay, I think we need to clarify that. We don't have 20 testing centers across the state. What we have is 20 walk-in centers where samples can be taken. Those samples will still get sent to the 3 testing centers.
Okay.
So apart from people who are going from house to house and hospital to hospital, we also have a team that we have left in health facilities across the state who do what we call the walk-in test. So they take a walk-in sample. You walk in, they take a sample, and they still have to send to the testing center.
So these are people. Now, the breakdown, Ikorodu gets 2, Alimosho has 6. Is there any particular reason why Alimosho got as many as 6 in that number?
Alimosho is a very big local government. It's made up of, I think, about 7 LTDs, if I'm right. And so that's why it had to get more walk-in centers.
Not necessarily because you have more number of cases there.
Well, one of the criteria also in distributing is yield, but this one is mainly because of size.
Mainly because of size. Let's go to the issue of transmission. It's quite strange that the person who was said to have died earlier today, I was reading that report on Twitter, on Professor Akinbayomi's Twitter handle, and they mentioned that they didn't have a travel history of some sort. Now, these people, it means that people who do not have travel history are beginning to get confirmed for COVID-19.
Yes, definitely. We're beginning to get community transmission.
Despite the lockdown order of the government. What would you say is responsible, first of all, for this sudden spike in numbers?
Well, don't forget that there's an incubation period, and so even with the lockdown order, some people who have been infected prior to the order will be manifesting symptoms maybe about now or maybe just for over the last few days or so. So that means that's still happening. And then, practicing is obeying the lockdown order or practicing social distancing when they're together. So,
Okay.
I mean, there will still be some transmission.
You're still talking about the lockdown because 2 weeks, I mean, barely a week into the lockdown, the Lagos State recorded 45% of community transmission, but about 2 or 3 weeks now into the lockdown, we have about 80% of community transmission. Are you saying the lockdown has been very effective?
Let's look at it from the supply side of the response.
Okay.
It has helped get round much better.
Okay.
We can reach people, we can move them into isolation, we can reach them for testing, we can move samples around to the labs a lot easier.
Okay.
And I know that it's also helping to reduce transmission, but it's also really helping the response, the supply side of the response.
Okay. So you have less people outdoors, which means you can meet them at home. We've had people say to us that they wouldn't let any of the officials into their residence. People send messages during the program and say they wouldn't allow the officials to come into their residence and all that. Do they go with security personnel when they go for this check?
There's a lot of things that are happening. One point is to make people understand why they need to have the test done.
Okay.
Force is not the first option that we're going to use at all. As much as possible, we try to convince them. We have psychosocial counselors that work with our teams, and several calls are made to people who initially are resistant to coming into isolation. People call them. Sometimes we engage people 3-4 times before coming at all. So force is the last option. Then one of the changes we've made is because all our vehicles have these big stickers on, we now sometimes when we need to pick people up, we go with vehicles that don't have those COVID markings so that it's not speaking out to all the neighbors that this is what is happening. And so people are more comfortable letting you into their houses when that is happening. But where there is a need to, we go with plainclothes policemen, so it's not too obvious as well.
Especially in cases where, have you had any form of resistance to being taken to an isolation center so far with this kind of method that you've put in place?
There are still people who resist, and then we keep trying. Sometimes it's on the third attempt that some people get into isolation. But sometimes it's even people who are not connected with the people you've gone to pick up. People in neighborhoods and along the road that get aggressive with the teams. That is more the reason, that is the greater reason why you need the security than actually engaging the people you want to pick up. Because usually when we engage them, counselors, it tends to work out a lot easier.
Earlier, while we were preparing for the show, Mullah and I were discussing a particular comment that despite the fact that they say there is no treatment, Mullah, there's no treatment. So what exactly have you been given?
To the patient, because Lagos State particularly has had a high number of recoveries.
Well, first, we wouldn't say there is no treatment. I think maybe what they say is for viral illnesses generally, what you do is supportive therapy. But here they are giving drugs, and people are responding to the drugs. And we are also actually about to start some clinical trials across the treatment centers that will be trying different treatment regimens against each other to see which one gives the best outcome.
So you've been giving them supportive therapy, and people have been totally responsive to that. Let's talk about the number of deaths that you've recorded in Lagos. I bring the total number now to about 16, if I'm correct. 2 were recorded today, and then you had 14 before. Now, of that 14 before, only 2 occurred at the isolation center. I want to believe that 2 today also occurred at some of your isolation centers. What has been the synergy between the private hospitals and the isolation centers of government?
We are actually also working closely with the private hospitals through the arm of the Ministry of Health called HEFAMA. And so HEFAMA has been engaging with the private hospitals and telling them the protocols for reaching out to us when they have patients that are suspected of COVID. And once they get in touch with us, we actually do help them evacuate people from those hospitals.
So how come there have been deaths? Because the NMA did say that they have been instructed, or private hospitals have been instructed not to engage in private management of COVID-19 patients. Is it that the patients have not been disclosing their travel history, their health status when they got there, or it is simply a case of the private hospitals not taking proper precaution?
Well, I think the first duty of any hospital is to secure the life of the patient.
Okay.
And when the patient comes, you don't actually have an obvious COVID result for the patient. And there are many other things that will present with the same symptoms. So what a private hospital will probably do first is take in the patient and take care of the immediate emergency needs of that patient, and then order a COVID test. When that test is done and the patient is positive, then the patient needs to be moved to an isolation center, in a government isolation center. One major risk we're running sometimes is people keep getting turned back from hospitals when they're even breathless and other things, which sometimes is even just asthma or some other obstructive airway disease, and then they don't get access to treatment and they die because some hospitals are insisting that, look, we must see a negative COVID result before we can handle you. That is not what we desire for this country or for the people. People need to get initial emergency treatment, and then a COVID test gets done. Once the result comes out, if it's positive, then the person gets moved to an isolation center.
What about patients with other kinds of illnesses?
Underlying.
I even mean people like pregnant women, now that hospitals are not operating to full capacity.
Well, even though hospitals are not operating full capacity, and especially the public hospitals, emergencies are still being taken and will be treated properly. And I mean, as also as a palliative that the governor has announced, people who come into any of the public hospitals as an emergency from the 1st of April will be treated free, because we know, I mean, he realized that a lot of people would not have access to cash or to even their bank accounts one way or the other. So there's still emergency services are going on in all hospitals.
Let's go back to community transmission here. We're still having a discussion right behind the cameras, and one of the things that we spoke about is the number of cases has spiked. We mentioned that earlier, but people do not even believe in certain quarters that COVID-19
is real.
There's the assumption that it must be malaria you've been treating in the isolation centers, and that's why the people are coming out. So they believe that they must go on the streets of Lagos rather to fend for themselves as against staying at home.
I don't know what I can say about that. I think we all know that COVID-19 is real.
Yes,
we all know that because there are very few social safety nets available for people in Nigeria. A lot of people earn daily money, and so when they are home 2-3 days, they feel need to go out and get something. But I know that the Lagos State government has put out a lot of palliatives, the food relief packages, and I know initially there were some issues about the way it was distributed, not because it wasn't well thought out, but because the implementation didn't turn out the way it was planned. But I know they've re-strategized now. They've come out with a stronger program that is better targeted at the most vulnerable.
Can we then say that it's because of the cost of treatment is the reason they do not want to submit themselves?
Cost of treatment? There's no
it's
cost.
very expensive.
Testing is free.
Okay.
Treatment is free for COVID.
Okay.
But majority of the people don't know that. What campaign is the government doing to make people know? What we see is palliatives, and palliatives. A lot of people have that erroneous belief that
the treatment is quite expensive.
Because
yes.
anything that is killing people like this must be the sickness of the rich, and if it is the sickness of the rich, it must be very expensive to treat.
Okay, well, maybe that's one of the advantages of coming on this kind of show and having this kind of discussion.
Exactly.
Now you can help us tell them, please, testing is free, treatment is free. Nobody pays a penny for anything to do with COVID.
What about feeding when you are in isolation?
Testing is free. Feeding in isolation is absolutely free. Absolutely free. There is nobody who's had treatment that has had to pay 1 red cent in any of our isolation facilities.
Thank you very much, Dr. Oboye. We
Thank
really
you.
needed you to clarify that, because we keep getting these messages that treatment is very expensive. It's the sickness of the rich, and it's the sickness of the elderly, or it's the sickness of you know, a particular sect of people who travel. Could you please help us expatiate and let everybody know what exactly it is and the importance of social distancing?
Not good. Okay, it initially did start as a disease of people who came back into the country from abroad, so to speak. But now it is no longer that. We are finding a lot of people who are positive that have no history of travel. So there is nothing to be gained by sitting somewhere and say, I'm partitioning the disease and say, no, it's not a disease of the poor, it's a disease of the rich. Let them go deal with it. No, it's not a disease of the rich, it's a disease of the poor. Let them go deal with it. Or I've never traveled, it's a disease of those who travel. Let them go deal with it. It is a disease of everybody, and it's affecting absolutely every and anybody. So we need to come together and take it serious. Now, the social distancing part is something everybody really needs to practice. That is the only thing that can slow down transmission, while all the other interventions that we're doing, we put them into place, and they're yielding lots of good results.
Okay, so still talking about social distancing, because it's been proven that that's one of the most effective ways to, you know, curb the spread at this time. But my concern is the marketplaces. You find out that most market women do not observe social distancing. What is the government doing about that?
Well, I know that there are people that are monitoring the implementation of a lot of these of the government directives. And I know that I've seen some places where even in markets, they limit the number of people that can be in at a particular time, so that they can then go, and those ones new people can come in. But I know there's a lot of monitoring going on. I'm not sure how effective that has been. But I think no matter how many people you put out to monitor or track something, the most important thing is for the people themselves to understand why they need to protect themselves and not put themselves in those crowd situations. If they never understand that, you can never have enough people monitoring them and supervising them. It's not possible.
Oh, so what is the appropriate distance between two people?
1 meter.
1 meter.
As far as possible as you can realistically be from each other. But about 1 meter is fine.
Oh,
okay.
1 meter.
1 meter.
Or as far as you can afford to stay away from the person. Interesting. From Monday, Lagos State government is going to begin to enforce the use of masks
face mask
and gloves. Exactly how does that prevent or protect us from contacting COVID-19?
You know that the most likely portal of entry is inhalation. So covering your face, your mouth and face with a mask will definitely reduce transmission that way. So and then also it's two ways. It protects people who don't have it from getting it, and then it stops people who have it from expressing it.
Okay. So
that way it minimizes transmission.
It minimizes the transmission. And the mask now is being said it could be any kind of mask. It could be a scarf. It could be the medical mask. But we have a shortage of that already in the market. We're not going to the fans or to the tailors. The tailors and the rest of them are not even opening shop. So how do we get this handmade
face mask?
Is the government distributing something like that to people as well?
Well, I think the way that will work out, I mean, we will find out.
Oh, that was actually on the lighter notes. That was actually on the lighter.
Okay, all right. Okay.
Thank you so much, Dr. Oboye, for joining us this evening. We hope that we'll be able to educate our people. Absolutely. Please say it again. The treatment and the testing for COVID-19, how much does it cost?
Free.
It's absolutely free. Treatment is free, testing is free, admission is free, discharge is free, going home is free, being picked up from home is free.
Feeding.
Nothing that you have to pay for at all.
Even feeding is free, right?
Feeding is free. Watching TV in the isolation centers is absolutely free.
And you
Even
treat
the
them to
governor has
lose
provided
Sunday.
entertainment. He's had bands go and play for the isolation sites so that to lift the spirits of the people there. That too was free. They didn't have to pay to listen to the music.
Many thanks for joining us, Dr. Shego Boye. We appreciate the good work you're doing and do pray that your team will continue to stay safe.
Thank you very much. Have a nice evening.
And you too, sir. We've been speaking with the Permanent Secretary of the Ministry of Health here in Lagos, and we've been talking about some of the important questions that people have, when it comes to the issue of COVID-19. Omolola, how much are we going to pay?
Absolutely 0 naira, which makes it very free.
Like absolutely free. Let's take a quick break. When we come back, this time we're looking at some gists around Nigeria. We'll be back.
Oh, lele. Oh, lele. Moliba makasi.
Oh, lele. Oh, lele. Moliba makasi. Oh, lele. Oh, lele. Moliba makasi.
Hello friends, it's Wazi here. Do you know why we need to stay at home right now? There's a new virus in town that's making everyone sick. It can make you a little bit sick or very sick. To make sure less people get the virus, we all need to stay at home. If we all stay in our homes, then the virus can't spread. So stay home and stay safe. See you later.
Yes, welcome back to COVID-19 update. We just had that conversation with Dr. Shego Boye, who's the Permanent Secretary of the Ministry of Health. Now to Omolola, who will be giving us some updates from Lagos.
Yes, just coming in now that Lagos has discharged 9 more patients of COVID-19. I mean, it's some good news that despite no death yet. No, I mean, lately,
two deaths.
with the with this news,
you had 2 deaths.
That's what I'm saying. Like with the breaking news, we didn't have that more deaths, and of course discharge. We just have 9 more discharges, and of course that's good news for Lagos State.
I hope we won't record any more cases.
We really pray so.
We really pray so. But from Kano State, they did record a death earlier, and the Kano State government says it is beginning investigation into claims that there was a surge in the deaths in Kano metropolis. It's saying the medics were yet to ascertain the medical cause of the said death, but acknowledged that the situation has sent residents of Kano packing. Now, they are panicking rather. The Commissioner for Health, Dr. Aminu Shanyawa, said that the ministry had embarked on a critical and a clinical investigation to unravel the cause of the deaths in Kano metropolis. He advised residents of the metropolis not to panic, urging them to observe preventive measures and personal hygiene while complying with the stay-at-home order. Remember, they're still in lockdown in Kano.
Of course. And moving to Borno State, Governor Babagana Zulum of Borno State has ordered a 14-day lockdown on the state over COVID-19 from 10:30 p.m. Wednesday. However, providers of essential services are exempted from the movement restrictions. The order came after the state recorded its index last Friday, and deaths from COVID-19 of a health worker. In a statewide broadcast, Zulum said he was worried over the way the index case was handled, as about 100 people may have been exposed to the virus. Security and intelligence agencies have been briefed for enforcement. Government will use this period of restriction to accelerate tracing and isolation of persons who have been in contact with the index case.
All right, back here in Lagos, the governor, we mentioned that in our interview earlier, the governor has declared that the enforcement of wearing a face mask in public places in the state will commence next week from Monday. Sanwo-Olu said this, that it is in order to continue the fight against COVID-19 and the spread of it in the state. The measure will help further prevent the spread of the virus. It is disclosed that over 1 million locally made face masks have been contracted out to tailors locally and will be distributed during the week.
And moving, back to the northern part of Nigeria, in Maiduguri, some doctors and nurses at the University of Maiduguri Teaching Hospital in Borno State are currently under quarantine following the death of a member of an international humanitarian organization. It's named Medicines Sans Frontiers, MSF, also known as Doctors Without Borders, who received treatment in the hospital. The deceased identified as Babangida Buba, who joined the humanitarian organization after retirement, was said to have been admitted to the hospital 2 days ago. A nurse who did not disclose her identity said she and some of her colleagues had raised the alarm that the late health worker should be moved to the intensive care unit of the hospital, but they were ignored. The patient was the index case of COVID-19 in Borno State, while the Nigeria Center for Disease Control and CDC also confirmed his death in an early morning tweet yesterday.
And 2 police sergeants serving with the Delta State Police Command have been arrested in the company of 18 others in Bumadi Town, Bumadi local government area, for violating the lockdown order by the state government, State Governor Senator Ifeanyi Okowa. The policemen in company of others were arrested at a hotel during a birthday party. The operatives are attached to one of the divisions in Asaba, the state capital, and were reported to have left their duty post to Bumadi for the party. Lockdown violation. Exactly,
because I really don't understand why people are still throwing parties.
This is important because it is policemen. These are policemen.
Okay, so well, it's good that I want to know what the government is going to do about this, because I don't want to believe they are above the law. Exactly, I do not want to believe they are above the law, really. And
don't forget that people are already sweeping in Kwara already.
Oh, okay.
Certain people are sweeping in Kwara and Ilorin. You ready?
It would be nice to see policemen, also partaking in community service, sweeping, cleaning, and all of that.
Fortunately for us, that may not be. They usually have a police trial in private, so that may not be correct, but it would be fantastic if we could have some more people. But don't forget that the lockdown order is still very much in place, and here in Lagos, community service is what you get, and instant trial. So you see that there are special courts already set up. You're not going to be kept in custody for a long time. They don't have space for you. They catch you violating the lockdown order, you go straight to the special court, and you are given your sentence of about a month of community service, which involves sweeping and the rest of it. Did you see the picture of people sweeping the streets of Abuja as well?
No,
some men, about 4 men, they were sweeping, and the policeman or the soldier was the one, directing them as to do the job very well.
Oh, that's fantastic.
So it's important that when you finish your community service, don't forget that you also be asked and in fact compelled to go into isolation for 14 days. So it is time that we all take that order, the lockdown directive, as very important. How do we close, Amorola?
Well, I'd advise that at this time, it's, be proven that social distancing and, of course, stay at home is one of the, ways to prevent or to avoid contacting COVID-19. So it's better that you stay at home at this period. And, of course, make sure you're washing your hands as frequent as possible. Try and stay safe this period.
All right, from me, do have a pleasant evening. Make sure that you continue to obey the lockdown order, and make sure you get your face mask ready for next week if you're here in Lagos. If you're beyond Lagos, also get your face mask ready, because the federal government is also looking at making that a compulsory outfit change for us in the next couple of weeks. I am Tomi Sejo. Have a pleasant evening.
And I am Omola Ololade. Enjoy the rest of your evening.